Who should come and meet a cardiologist?
So you'll be surprised to know cardiovascular disease is the leading cause of death across the world. We don't trust clinic blood pressure because clinic blood pressure is usually high because you have something known as white coat reaction. So as soon as you come to the clinic, your blood pressure comes a little bit high.
How accurate are the readings that we get on smartwatches?
I don't trust them. Whenever you check your arm, your heart and your machine should be at the same level. If your machine is down, up, your hand is down, up, it will show false readings. So I have patients, they say that Monday to Friday my BP is high, but Saturday, Sunday my BP is normal. So I will not take the medicine.
Welcome to our first episode of our YouTube channel, Doctor, the Gen Z Care. The basic idea of this podcast is to try and make the younger generations a little aware of their health and in general, the entire thing about allopathy medicine and also health in general. So that's the whole idea about this podcast channel. After a lot of struggle, after going through a lot of repeated takes, which we both encountered previously. So here we are, finally shooting a podcast in an official studio. Looks good. I'm really happy.
Yes, same here. Thank you for inviting me.
Thank you. Firstly, a little bit about yourself. If you could just tell our viewers, what medicine field are you into and what exactly do you do on a daily basis?
Yes, so I'm Dr. Mohit. I'm practicing as a specialist cardiologist here in UAE.
Right.
I'm practicing here since last 2 years. I have done my bachelor's, master's, and doctorate in cardiology.
Right.
So yes, we'll be talking about cardiology mostly.
So we will basically be talking about everything to do with cardiology today,
Yes.
as a whole. Firstly, actually, I wanted to discuss with you something that I came across personally. A couple of days back, I was actually talking to my friend, and I was telling him that I'm planning to start a podcast which is basically related to allopathy medicine, and to my surprise, I realized that he was actually wondering if allopathy medicine is Ayurveda. Okay, so people in today's day and age are not uh, well versed. I mean, in general, I was working together with him in Jet Airways, and a guy educated as him, if he doesn't know what allopathy medicine is, I think a lot of youngsters don't really care. They feel that the normal medicine is not known as
In our education system, so health education and financial education, these two
Okay.
education, these are the two main things which is running your life, and we are not really well versed with these type of two educations, which is a very essential part. You should know about it.
Right. Okay. So, what are the different medicine options available, which are practiced usually in current day and age?
So yes, the most widely practiced modern medicine is allopathic medicine.
Okay.
Then we have Ayurvedic medicine, we have Unani medicine, homeopathic medicine. There are multiple systems of medicines, but the yes, most widely practiced,
Okay.
evidence-based. So whatever we practice in allopathic medicine is evidence-based. Evidence
Okay.
means we collect the data. How do we collect the data? Whenever we have any doubt, clinical doubt, we want to try something new.
Right.
So we have a 4 stage of clinical trials.
Okay.
So in all the 4 stages, we test everything. Any test we want to do, any new medicine we have, so we'll test in the clinical trials. Then after all the stages, so means any form of treatment we are offering you, it has already been tested in lakhs and lakhs of normal, abnormal, all types of subsets, all types of patients, and then it's coming to you.
Okay. So there are multiple trials which are done already, and based on the trials, based on how a particular medicine would react, is what the entire allopathy medicine is based on.
Yes. So we
Okay.
basically call it EBM, evidence-based medicine.
Okay, evidence-based medicine.
Yes.
Okay, and could you tell us a little bit about what cardiology is all about, and what are the major thing that you see on a daily basis? If I have to ask you, what are the kind of patients that you see on a daily basis? Who should come and meet a cardiologist? Let me put it that way.
Yes, that is also
Yeah.
very important. I was
Yeah.
talking about we have almost zero health knowledge in schools, and also at least you should know what basic specialties are about.
Right.
So yes, cardiology is about heart and anything related to heart. So your blood pressure also comes in cardiology.
Okay.
Your any type of heart disease. There are multiple types of heart disease. It can be a muscle disorder, it can be a valve disease, it can be blockage in the arteries, it can be a disorder of the electrical rhythms of the heart. So anything related to heart and attached vessels. So any blockage in vessels, pressure increase in vessels, low pressure in vessels.
Okay.
So it is known as basically cardiovascular science.
Okay.
So anything related to heart and all the vessels in your body.
Right.
So even if it is a vessel, it is going into your kidneys, it's blocked, it's related to cardiology.
Absolutely.
If it is about kidneys, it goes to nephrology. But till the vessel is concerned, so we are there in the cardiovascular. So it's not cardiology, it's cardiovascular specialty.
Cardiovascular
Vascular,
specialty.
yes.
Okay. Okay. Perfect. So if I have to ask you in general, like, what are the major things that you come across on a daily basis? Let's try to cover three to four of it in general. So what are the major issues that you face on a daily basis as a cardiologist? What are the patient complaints that you get?
So mostly I'll be getting heart attacks and after or follow up. Like if the patient has gone to some place else, then they come for follow up after they having heart attack. So this is the major, and cardio. You will be surprised to know cardiovascular disease is the leading cause of death across the world. Not only in a single country, around the world it has become the leading cause of death. So most of the times would be a heart attack, coronary blockage, and associated risk factors. So we have few associated risk factors, that is high blood pressure, diabetes, high cholesterol, family history of early age heart attacks. Early age we call it if you have any family member getting a heart attack at less than 60 years of age.
Okay.
Then yes, you are at a genetic risk of getting a same disease.
Okay.
And addictions and stress, which again cause this. But yes,
Okay.
these are the major things which we see.
If I have to talk about blood pressure, so how do you measure blood pressure? Firstly, what is blood pressure? How do you measure a blood pressure, and what is normal as per you? And what does allopathy medicine say about how to handle blood pressure? If I have to ask you that.
Okay, so blood pressure is basically we measure the pressure in your arteries.
Right.
So it is composed of two things. One is systolic blood pressure. So whenever you check blood pressure nowadays, it's every place. Even if you go to a supermarket, you can find electronic BP device.
Right.
Okay.
Right.
So it measures two things. So one is bigger number, usually we see 130, 120. That is systolic blood pressure. And the another number you see is diastolic, the lower one. It is diastolic blood pressure. So both are important.
What is systolic and what is diastolic?
So systole is basically the time when your heart is pumping, and diastole is when your heart is resting.
Okay.
So
Okay.
in a minute, if your heart pulse rate is let's say 80, so 80 times your heart is beating. So in a minute you have 80 systoles and 80 diastoles.
All right. Okay.
So the systolic is the upper pressure when
Diastolic
your
is
heart is beating. Diastole is the basal tone of the vessel. Both are important, but if you ask me one, then yes, diastolic pressure is more important because a slight increase in diastolic pressure is much more harmful than increase in systolic blood pressure.
Okay. And what is normal and what is
Yes.
abnormal?
So 130 by 80 home
Okay.
pressures.
Okay.
So nowadays we recommend that once you're 21, you should be checking frequently your pressures.
Okay.
So if your pressure is normal, then you check once or twice a month. If your pressure is abnormal, then you check more frequently.
Okay.
So normal pressure is home pressure should be within 130 by 80.
130 by
130
80.
by 80 within 130 by 80. Usually low pressure is not much a problem.
Okay.
So anything more than 100 by 60
Okay.
should be fine. It should not create a problem. But yes, it should be less than 130 by 80.
A normal human, an adult that we're trying to address here, basically our viewers are going to be within the range of, let's say, about 18 to 40 is our major viewers age category going to be, right? So for an adult, like somebody who's between 18 to 40 or 45, so it should be between 130 by 80, right? That's
No,
basically
130 by 80 below this, like systolic below 130,
okay.
diastolic below 80.
Systolic below 130, diastolic below 80.
Yes, earlier we used to say 140 by 90, but now because of so much incidence in heart disease
Right.
and blood pressure is major, so it contributes 4 times than the other, like diabetes, cholesterol, they are also causative, but blood pressure is a very major risk factor. So that we have brought down to 130 by 80.
Okay, actually, on that note, while I was doing a bit of research, I figured out that 46% of the world's population is suffering from high blood pressure, and basically these are in the uh, developing countries, not even in the developed countries, but two-thirds of the population is actually from underdeveloped and developing countries. So would you say that blood pressure is something which probably everybody might have, and we're not just being, considerate about it, or probably not checking it on a regular basis? Would you say
Yes, yes,
that?
there are many patients who are undiagnosed. There are many patients who are undiagnosed. That is why it is called as a silent killer.
Right.
Because you don't know you have high pressure. You know when you have a complication. Complication are usually brain stroke, heart attack, or kidney diseases. So you usually come to know when you already have an episode.
I mean, nowadays we've got different ways to measure blood pressure, right? Back in our days that I've seen, I mean, I got exposed to medical sciences because I was working with you previously, as you're aware. But previously, what I'd seen was with a pump, doctor trying to check something like an L-shaped device wherein the pressure going up and coming down. So, would you say the manual way of measuring blood pressure was accurate, or probably the digital one right now that we've got in the market available in the pharmacies? You can buy it online. You can actually.
So see, the most accurate way of blood pressure measuring is you put a catheter inside your artery and measure, but we cannot go and inserting catheter. So
Okay.
we have to find a practical solution. So yes, mercury is the mercury thermometer which you are talking about, olden days which you used. Yes, that is more accurate, but it has its own challenges. So everyone is not accompanied. Nowadays, what we trust is home blood pressure monitoring. We don't trust clinic blood pressure because clinic blood pressure is usually high because you have something known as white coat reaction. So as soon as you come to the clinic, your blood pressure comes a little bit high. It happens to most
Is
of the.
that psychological?
Yes, it is psychological, maybe a reaction from your childhood. When you're a child, you have a fear of the clinic. You come to the clinic, your blood pressure rises subconsciously.
Okay, okay. This is
So yes, this
interesting.
is a
Okay.
white coat reaction. Most of the time they are having. Plus, you walk to the clinic immediately. You're driving a car, go directly check your blood pressure, comes high. So what we trust now is home blood pressure readings. So now home blood pressure, the mercury is not possible. So now whatever data we have, the newer data is recording with the electronic BP machine.
Okay.
So yes, the problem with the electronic BP machine is calibration. It should be calibrated once every year.
Every
So
year.
yes, once
Okay.
every year. So either you change your machine or you change or you calibrate it regularly with someone if the company is offering.
How often should we check? Like in a day, if I have to say, let's put it this way. I'm a guy who's actually going to office, go probably 9 in the morning and come back by 6 in the evening, right? Uh, I'm fairly healthy, like you see. I'm healthy, but I don't do a.
You think you're healthy.
I think I'm
Yes.
healthy, actually. But yeah, the reality of the fact is that I don't work out. I barely have physical activity. So, what would you suggest should I do, or probably somebody who's like me? Because in Dubai, a lot of them have the same habitual kind of job that they keep doing, and mostly not doing any physical activity. How often should people like me check blood pressure?
So see nowadays once you are 21, so like I said, once you're 21, you should be checking your few things regularly. One is sugar, one
Okay.
is blood pressure, one is cholesterol.
Okay.
So once you're 21, check it once.
Okay.
So let's say you're 30, anytime, any age you are, you have not checked any time. So just check it at once, depending on what comes up. If it comes abnormal, then you check more frequently, maybe every 3 months. If it comes very high, which needs treatment, then you start treatment. If it comes normal, then you check once every year.
Okay.
So all these things. So depending on what comes, if it comes normal, and so sugar, it can be a spot thing. So sugar also we trust is HbA1c. That is a 3 months of an average sugar. We don't trust spot sugar. So
Okay.
it will vary depending on your diet, depending on your fasting status.
Okay.
So HbA1c, your cholesterol profile, and your blood pressure. Now blood pressure, I'm talking not about single reading.
Okay.
So it should be an average of few readings. Let's say 10 to 14 readings you check at home, and at different times and different days. Like let's say you check before going to the office, you have a one reading, one
Okay.
or two readings you have in the office.
Okay.
Nowadays, most of the offices have a BP machine. If they don't have, you ask your boss.
Okay.
So you are giving your boss so much. You
Yeah,
should
yeah.
ask
All our
something.
viewers should ask our
Yes, yes, yes.
bosses. Yeah.
Yes, yes. So,
Huh.
yes, your employer is they are making use of you. So you should also, you can ask at least a blood pressure machine. So two or three reading, one or two readings in the office, and once you come in the evening at the home, you check. So you check it for 2-3 days, and whatever readings you have, you take an average. Whenever you check your blood pressure, use the normal cuff machine. Don't trust the BP. Nowadays, everyone comes with the watches, smart watches. Don't trust the blood pressure which
Yeah,
comes in
on
the
that
watch.
note, I wanted to ask you, sorry to
Yes,
cut
no,
you
it's
down.
okay.
How accurate are the readings that we get on the
No, I don't
smartwatches?
trust them.
You don't
I
trust
don't trust
them.
them. Only
Okay.
the smartwatch, importance of smartwatch has been shown in an Apple Watch study. It was
Okay.
study done.
Okay.
It has been shown to detect atrial fibrillation. That is a rhythm of your pulse.
Okay.
So only that is the importance.
Okay.
Otherwise, for blood pressure, we don't trust it. You
Okay.
should check with a normal cuff which you put in the on your
Okay.
upper arm, not the wrist one also.
Okay.
Okay, on your upper arm.
Okay.
Whenever you check your arm, your heart and your machine should be at the same level.
Okay.
If your machine is down, up, your hand is down, up, it will show false readings. So heart is on the left side, just in case you don't know. At this level, at the level of the
It's
nipple,
supposed to be in the center, right? If I'm not wrong, slightly towards the
center
center.
and left side. Yes,
Okay.
slightly towards the center and left side.
Left side. Okay.
So you press the button, whatever reading comes, you note it down,
Okay.
and you take out an average of all the readings you have checked over 3 days. So that
Okay.
is your blood pressure.
Would your blood pressure be the same at all times? Like when I'm probably woken up, when I'm probably doing a bit of, walking, to when I'm completely like going to bed, like just about to go to bed. So how does it change?
So blood pressure will keep on changing every moment depending on your diet, depending on your salt intake, depending on your hydration status, depending on your stress levels. So I have patients, they say that Monday to Friday my BP is high, but Saturday, Sunday my BP is normal. So I will not take the medicine. So that is not a logical answer, because your heart, your brain doesn't know that this is Saturday, Sunday. Let's say if Monday to Friday I'll not make diseases. It
Correct.
will start reacting abnormally. So that is why you have to take an average and find out an average and go for that.
Okay, so you're saying that find out an average, basically make about 10-15 of these
Readings.
readings overall, and then if you find that it's slightly elevated than 130 by 80, then it's a good time to actually go consult a doctor, right? In
Yes.
general. Okay.
Yes.
Okay. What are the typical symptoms that you might notice for somebody who is probably witnessing a high blood pressure?
So see, early stages, let's say 140/90, less than 140/90, you will not have any symptoms. Mostly you will not have any symptoms. That is why, again, silent killer. It doesn't mean that it is a normal pressure and it is not causing diseases inside.
Right.
But usually once you reach stage 1, which we call more than 140/90, and most of them will not have symptoms in stage 1 also, they will have more than 160. So the usual symptoms are, you will get headache, especially on the back part of the head.
Okay.
You will get dizziness. You will feel a
Mm-hmm.
little bit dizzy.
Okay.
You will feel palpitations. In Hindi we'll call it ghabrahat.
Ghabrahat, right.
Ghabrahat. You will get
Yeah.
palpitations. You will
Acha.
get difficulty. You'll see your exercise capacity has gone down. When you walk, you are not able to walk that much. You feel fatigued or you feel breathless. These
Okay.
are the usual symptoms we see.
Okay. But some of those that you mentioned, right, could happen because of other aspects as well, right? So, how do I put it? When I probably have a fight with my wife, I might probably be stressed. How do I accurately know that this could be for sure one of the early signs of blood pressure? Like, should all of these come together, or it can happen at different intervals that you've just not noticed, or it's just a good idea to check your blood pressure once in a
Yes.
while?
So see, again, I told you, single reading is not important. You have to take an average of multiple readings. So whenever you are stressed, obviously your blood pressure will go high.
Okay.
So you should always take an average of few readings and then check. Symptom wise, blood pressure, you might not be having any symptoms. You might be having one. You might be having all.
None.
None. Yes. So it's very difficult to say that who will have which.
Okay.
So that is the problem. You have to do a screening, and that is why it is very important screening. Nowadays, they have recommended recently, they have launched a guideline, European Society of Cardiology, about prevention of heart disease. They say that even if you go for other reasons, let's say you go for a flu to a doctor, you should check your cholesterol.
Okay.
Once you're 21, you should check. Even if you go for a flu, check your cholesterol at least once a year. Check your sugar, check your blood pressure.
Right, right. I think this is one such thing which a lot of youngsters are missing out on, and especially people in Dubai. I'm sure they can do it because most of them have insurances, right, offered by the companies that they work for. Most of them do have it. So there's no harm to go and do a blood test once in a while. Just meet the doctor, do the basic cholesterol, diabetes, blood pressure test, and basic things like what would you suggest you should do it like every once in 6 months if I have to ask you?
If you have everything is fine, you don't have any symptoms and everything is coming normal, once a year is more than enough.
Once a year.
If you have abnormal, then yes, more frequently, depending. If you have abnormal, you'll go to a doctor and discuss, so whatever
Okay.
he advises. But yes,
Okay.
if you don't have anything, at least once a year you check.
Okay.
Blood pressure you can check at home, as I said. If it is
Right.
high, you go.
Right.
Sugar also, you have a devices for checking sugar, glucometer. You can go to any supermarket, any pharmacy, buy it, check it.
Right.
Or if you prefer to check in the lab, you can go in the lab and check.
Right.
And cholesterol also, cholesterol, it's better to check. Nowadays we have new devices which gives you spot cholesterol, same like sugar, but we trust the lab more. So
Okay.
sugar and cholesterol nowadays, many labs will have packages, many clinics will have packages, many hospitals will have packages.
Okay. We can
Your
get that
insurance
checked.
will approve, so just go and check.
Right. Okay. Let's talking about just blood pressure for now. I'll talk about cholesterol and uh, sugar later. Uh, I just wanted to ask you how important is a diet in terms of blood pressure, and how do we treat the blood pressure in general, and let's say we notice now we were talking about continuously measuring your blood pressure on an average, right? So I know for sure my blood pressure is increased because I've been monitoring it for probably past week, and I figured out my average is much higher than what we just discussed about, which is 130 by 80. So what should be my immediate response? What should I do?
So see, if your blood pressure is high, then you should go to a physician, go to a cardiologist and discuss.
Right.
So usually how we treat is, let's say you are young, you don't have any other associated risk factors. Then if you're in the stage one, if you're in the pre-hypertension range, that is 130 by 80 to 140 by 90,
Okay.
then I would like to advise you lifestyle first. So
Okay.
lifestyle advices for blood pressure would be
Okay.
low salt diet.
Okay.
So low salt diet means you just have to, you don't, some patients I say low salt diet, tomorrow they'll stop eating salt.
Okay.
So you don't have to
Yeah.
stop eating salt. Salt is a very essential part of the diet. So you have to decrease the intake of salt. The type of salt is very important. So you go for, nowadays low sodium salts are available, Himalayan pink salt, natural rock salts. So these are good for your blood pressure. And many part of your food has hidden salt. You don't know about it. Your butter has salt. Your all the packed foods you eat, pickle,
Right.
papad, achar, namkeen, mixture,
Okay.
bhujia, so
Right.
many things. All the preserved foods, they will have salt. So you have to cut down those additional salty things.
Right. Right.
Uh, we put salt in the vegetables, salad, fruits from above. So those all extra salt you have to cut. Little bit of salt in your vegetables are
So
fine.
in general, you're saying just be a little conscious about your
Conscious about, yes, yes.
salt intake, right?
Salt
So
intake, yes.
because as an Indian, like in our culture, it's quite ingrained to have salt as a major aspect of our diet, right? So not necessarily the same for probably the Arabs and the other nationalities as a whole, but Indians, we have the salt is a major component of any recipe in our kitchen. So basically, you're trying to say that be a little mindful about how you use your salt.
Salt, yes.
Now, that is okay. That is when it comes to kitchen, right? So when you go outside, if I'm going probably outside, the lifestyle in Dubai is such that weekends are the way that you get your family out of your house and then try to get them to see the entire city of Dubai, right? So what would you suggest to avoid when you go outside in terms of diet?
So go outside, you go outside once a week, you eat, it's fine.
Okay.
But most of the times on a day-to-day diet, you should not have high salty food.
High
Because
salty food.
again, if you go out, you have less salty food, there's no purpose of going out.
Okay, yeah.
So you'll not enjoy that food. Yes.
Right.
So once in a while, it's okay. But
Okay.
most of the times, you should be on a low salt diet.
Low salt
You have to
diet.
check
Okay.
your weight.
Okay.
So you calculate your BMI,
Right.
body
Right.
mass index, that is
Right.
your weight divided by height in meters square.
Okay.
So you calculate your BMI.
What's your ideal BMI
Less
should
than
be?
25.
Less than
Less than
25.
25. For Asians, it's less than 23 is better.
Is it separate for females and separate for males?
No, as of now, less than 25 is common.
Okay.
So you keep your BMI less than, if your BMI is high, You work on that, consult a dietitian, maybe decrease the carbs in your diet, decrease fat in your diet.
Right.
Carbs and fat we'll discuss more in sugar and cholesterol.
Right. Okay.
And most important part is exercise. So
Okay.
exercise, if you have high blood pressure, we recommend you complete at least 150 minutes a week
Okay.
of moderate intensity exercise. So
Okay.
moderate intensity would be when your heart rate jumps to somewhere around 150, 140, it depends on your age.
Right.
So there is a formula we calculate. So 220 minus age
Okay.
is your target heart rate. So 70 to 85% if you reach of this 220 minus age, that is
Okay.
moderate intensity exercise.
Right.
No need to calculate every time and be more conscious. You just know that you are doing a moderate intensity. It will be like brisk walking.
Brisk
So
walking.
150 minutes a week. So you can do it like 30 minutes, 5 days a week.
Okay.
Or if you go for high intensity is like jogging, swimming, cycling, Zumba. So
Right.
which pushes your heart rate
Right.
up to 220 minus age.
Right.
So that will be, let's say you are
I'm 33 right now.
33.
Yeah.
So somewhere around 190. So
190.
185 to 190. If you reach that
Okay.
heart rate, then you can do 75 minutes a week. That is 25 minutes 3 times a week. So if you're busy, you say I don't have time. Just do this much. 25 minutes 3 days a week is I think easily manageable for everyone.
Right, yeah. Yeah. So 75 minutes in a week should not be a big problem. So it's just going to be brisk walk. Okay, now if I have to define a brisk walk, so everybody has their own definition of it. So how would you describe a brisk walk as?
Okay, so brisk walk is basically you take equally long steps and in a fast pace. So the idea is, again, I told you, the idea is to increase your heart rate. Any cardiovascular exercise should increase your heart rate.
Okay, okay.
So it should be 70 to 85% of your 220 minus age. So let's say for you, if you're we do 220 minus age, it comes 187 for you. Then 70 to 80% should be somewhere in the range of 150 to 160. So if you reach that heart rate, so initially you can check in your watch, smartwatch, I am reaching that heart rate or not. And once you reach that heart rate, that is brisk walking for you. So you can define for yourself what is your pace which is increasing. So let's say someone who is an athlete, for him to reach that heart rate would be it would take more intensity.
Okay.
So depending on how our tone of the body is, or how our baseline heart rate is, for everyone it will be different.
Okay. Doctor, when we were talking about on the lines of me being healthy, right? We just had a good laugh a little while back when I said, I feel I'm healthy. But nowadays that we see a lot of celebrities, succumbing to heart attack, probably at an early age. They're quite fit in general. They work out. Obviously, they've got six-pack abs. Mostly from the modeling and the social media and even the movies, to be honest, kind of industry that they belong to. And they passing away at such an early age, having such good physique, makes me question as how exercise as a whole uh, is helping me, right? So when you said heart rate could be different for me and an athlete, right? So yes, absolutely, for a person who's an athlete it might be much easier for him because he's used to a different routine, and compared to me where I don't have any physical activity, could be much more of physical work for me, right? So should I do so much exercise? Should I really concentrate on building abs and building muscles, or should I just?
No, see, it's not any particular industry. Everyone is getting. We know movie stars. We know, so it comes in the media, and we know everyone is getting
Right.
these type of things. So the idea is prevention. Now, their factor comes. You are saying that they are healthy, they are into fitness, and why they are getting. So that comes the factor of stress and genes.
Okay, okay, okay. All right.
So stress nowadays everyone is having. Even if you don't realize, you have subconscious stress. You have lots of things going on in the mind.
Right.
So the subconscious stress is there, and obviously genes we cannot change. We cannot
Absolutely.
go back and be born from another father or mother. So genes we cannot change. This is what we have. So genes, especially, it is important if you have any family member getting the same type of thing at less than 60 years of age.
Okay. Is it safe to say that probably if my parents have been struggling from blood pressure issues and they've figured out, it's high time for me to start being conscious about it?
Yes, if your parents have been, you start being conscious about it. Like I'll tell you my thing. So my grandfather, he suddenly died at 55 years of age because of brain hemorrhage. because he had high blood pressure, did not realize, landed up in brain hemorrhage. My father, he has been having hypertension since a long age, since again 40, 45 years of age, and he is 66 and healthy now. So because I have been treating him since last 20 years, so again a misconception. Many patients, young patients, they come to me, once I tell them that now it's time you should take your blood pressure medicine, because their lifestyle doesn't work. So I'm telling them to do lifestyle, so it doesn't work because there is a genetic component which is not changing,
Right.
there is a stress component which is not changing, or they are practically not able to do exercise
Right.
because of the busy lifestyle. So after 3 months, so this is my usual day to day. Every 3 months they keep on coming, they promise next time I'll do this. After 1 year they come with a heart attack. Now there's no going back. So earlier I would be telling they should just take one medicine for the blood pressure. Now they are taking a list of medicines, and now they are worried how did this happen. So yes, you see your history, you know how did it happen.
Okay. Is obesity one of the concerning factors for high blood pressure? How
Yes,
does
yes. So I
obesity?
talked about it. So BMI
Yeah.
more than 25. Yes, you have to, anytime you have BMI more than 25 with high blood pressure, you have to decrease your BMI to less than 25. So that will be by diet and exercise.
Okay. By diet and by
By
exercise.
diet, by exercise. Yeah. And yes, additional one, smoking. So addiction, any type of addiction. So chewing tobacco, smoking, alcohol consumption. If you consume more than 15 drinks a week for a male and more than 7 drinks a week for a female.
Okay.
So yes, these are all risk factors for high blood pressure.
Risk factors for high blood pressure. Okay. So we were just talking about, so to end the whole blood pressure subject, I just had one quick question. Uh, is blood pressure curable? If so, how? And apart from curing it, is it manageable? Can I keep it in check? Is my question.
So hypertension we basically classify into two types, primary and secondary. Primary means there is no cause. Means it is because of your lifestyle, because of your diet, because of your genes. That is partially curable. Let's say your BMI is 30, you are 110 kgs, you eat unhealthy, your life is very stressful, and your blood pressure is in the stage 1 or pre-hypertension range. Let's say 150s, 140s. Yes, if you lose weight, if you decrease your habits, smoking, alcohol, if you start losing weight, if you improve your diet, if you start exercising, then yes, you can be rid of hypertension. But let's say you have very hypertension, it is because of the genes, then yes, you could not be getting. So most of the times when we see hypertension, 95% would be primary.
Okay.
Means most likely it will not change, but yes, it may change depending on your commitment to your lifestyle. 5% cases would be secondary hypertension.
The earlier the better, you would say.
Yes, the earlier the better.
Okay.
So 5% would be secondary, means there is some cause which is causing hypertension. There is something known as pheochromocytoma. It is a tumor in the adrenal gland which is causing hypertension. Sometimes you have blockage in the kidney arteries. So yes, those are treatable causes of hypertension,
Okay.
but those are very rare.
Okay. And so, if I have to put it straight, so basically, it's better to manage it first, and through diet, through exercise, it can be kept in control. But in certain cases, not just the diet and diet and the exercise, but also you would say the supplements.
Again, supplements, yes, vitamin D supplement has been shown to be beneficial in hypertension, but yes, that is not the treatment for hypertension. No supplement is a treatment for hypertension. Nowadays, they give arginine supplements also for hypertension. They claim that it treats hypertension, but yes, those all we can do. You can do an additional to
But
your.
again, a medical expert like a cardiologist should be consulted in terms
Yes.
of any kind of medication.
Yes, it can. In terms of medication, if your blood pressure is say pre-hypertension, let's say your average is coming 135 by 85, you can try at home also for 3 months. Again, you should not be having anything additional. Let's say you have with blood pressure, high sugar, high cholesterol, you have a very strong family history, all the family members getting heart attacks at 40s, 50s, then yes, you should treat that level. So it depends on person to person. It's not that one formula works for everyone.
Correct. Absolutely,
Yes.
absolutely. Could you bust some myths about both blood pressure and cholesterol? Because I forgot to ask you about it, because I think it's a very important aspect to address. And I'm sure you come across on a daily basis about myths related to blood pressure and cholesterol. So if you could just tell us a
Yes,
few.
yes, too much.
Yeah.
So there are too many myths going around. So first
Uh,
thing is, if I take my BP, cholesterol medicines, my kidney will fail, my liver will fail. It is the disease which is your blood pressure will damage your kidneys, your cholesterol will damage your liver. Medicine, yes, if you take it by a prescribed who is a licensed physician,
Right.
so yes, you are taken care of any side effects which is happening,
Right.
and it's always about in medicine risk benefit ratio.
Right.
So we always have a risk benefit, especially in cardiology, because the benefit is protection of life.
Correct.
So any risk which is there, it's worth it.
Absolutely. Yeah.
So yes, there are medicines which causes some side effects. There are
Right.
medicines it can cause at high doses some side effects.
Right.
So we have ways to curb those side effects. We give you a combination of medicines in place of going to high dose of some medicines.
Right.
We usually regularly monitor you for some known side effects.
Okay.
But usually what patients do is they start taking the medicine. Let's say
Okay.
I've given them a prescription of 1 month, and after their blood pressure comes down, they say, now I've been treated of blood pressure. So no, that is, and they stop the medicine. Again, the
Okay.
blood pressure goes high. So
Okay.
as of now, we don't have a permanent solution. Permanent solution for your blood pressure and cholesterol is your diet and exercise.
Okay. Okay.
We keep your, so if it is because of your lifestyle, because of your diet, it slowly goes off.
Right.
And then we taper the medicine. So the word is taper. We don't
Okay.
stop.
Okay.
Decrease the dose and
Okay.
gradually withdraw it.
Okay.
And if it is because of your genes, because of something lifestyle which is not practically working, it will not go, that we manage with medicines.
Right. Right.
So yes, you should not abruptly stop the medicines,
Okay.
and the, the medicines are not going to fail your kidneys and liver. You have
Okay.
to keep on checking. You have to consult your physician.
I've noticed one more thing, doctor. People expect for quick results, right? Let's say I've got cholesterol. This I'd noticed when I was working in the clinic. So you go to meet a doctor. Doctor will give you medicine. They see it for probably a little while. They see there's no difference. They immediately change the doctor, right? So would you say that's a wrong practice? Would you say you should give a significant amount of time to a certain line of treatment that you prescribe as a doctor?
Yes, of course. Yes. So correct thing you said. This is also a myth. So again, I can give you a medicine in one day. Your cholesterol becomes normal, your sugar becomes normal, your blood pressure becomes normal. But that is not the way we treat. Unless and until you are having an emergency, let's say you are having a brain hemorrhage because of blood pressure, then yes, I would like to immediately control your blood pressure.
Correct.
But if you're not having any complications, I would like to go it down slowly and find the correct dose for you. So how I'll give you a 1 week of medicine, ask you to monitor your blood pressures on a low dose.
Okay.
And choice of medicine is also different. So if you are young, I would like to give you a medicine which will have its full effect in 3 to 5 days. So there are medicines which will have its full effect in 1 day, but that is not my first choice for you, because for you I'd like to give you a medicine which will be good for you in the long run, let's say next 30 or 40 years.
So it's basically you're trying to say is personalized for everybody. So it's tailored, right? So it's basically your observation as a whole is what is best needed for an individual and go
Yes,
by
so
that. So
medicine is always tailored, and nowadays we have come up with a new concept, that is pharmacogenomics.
okay.
Means based on your genes, we will prescribe you medicines. So
Is it
that is
available in Dubai?
no, it's still pharmacogenomics is still under research,
Okay.
because we have seen that there is a blood thinner clopidogrel. Many Indian population, Asian population is resistant to it.
Okay. Okay.
So that is why nowadays concept of pharmacogenomics is still under research. We are not practicing it widely. But yes, medicine has to be on a personalized basis. It's not like one formula works for all.